Hello and welcome. I am Dr. Taylor Viggiano, and I am so excited to be speaking about hidradenitis suppurativa and the Mediterranean diet for the Integrative Dermatology Symposium. HS, or hidradenitis suppurativa, is a chronic inflammatory condition that affects individuals, particularly in areas where there are high concentrations of apocrine glands. It's characterized by painful nodules and abscesses that develop into sinus tracts. HS is a debilitating condition that has been associated with higher rates of inflammatory conditions, including obesity, smoking, and diabetes, especially when compared to rates found in the general population. Furthermore, at a molecular level, HS individuals have been found to have increased levels of inflammatory markers like the cytokines TNF-alpha, IL-1B, IL-17, and oxidized LDL. The Mediterranean diet is a plant-forward olive oil-based diet that has lower rates of red meat, processed foods, refined grains, and ultimately, the Mediterranean diet has been associated with lower rates of obesity, insulin resistance, and systemic inflammation. This study is a systematic review that was conducted in accordance with PRISMA guidelines. The search terms are reproduced below, and the criteria also reproduced below. 64 studies were identified in the review, and 3 met inclusion criteria. I'm going to skip ahead to the table for a more in-depth review. The first study that I will talk about is Baria et al. This is an Italian study published in 2018. That's a case control cross-sectional of 41 patients with HS and 41 healthy controls. Of the individuals with HS, the average age was 26 with a predominance of female participants. HS severity was assessed by 3 scales, the Sartorius, the Hurley staging, and the Physician's Global Assessment, or the PGA. Adherence to the Mediterranean diet was evaluated with the Predimed questionnaire, a 14-point questionnaire of various food groups. And ultimately, this study found with a multivariate regression that a higher adherence to the Mediterranean diet was significantly related to a lower severity of HS. Similarly, another Italian study published by Larita Fuentes et al. Was a cross-sectional non-case control that included 221 patients with HS, an average age of 38, and a predominance, again, of women. This also used the Predimed questionnaire and the Hurley staging, in addition to the International HS Severity Scoring System. Similarly, the study found that a higher adherence to the Mediterranean diet was again associated with a lower scoring severity on these various systems, or scoring systems. The last study that was included was a study published out of Spain, another case control cross-sectional with 35 patients with HS, 35 without, and an average age of 30, predominance of women with similar scoring systems. This study instead assessed adherence to the Mediterranean diet with the Med Diet score, an 11-point score, very similar to the Predimed questionnaire. However, this study compared HS individuals as a whole compared to a control group. And so it found that adherence to the Mediterranean diet was lower in individuals with HS when compared to healthy controls, but not at a significant value. And it did not evaluate whether the severity of HS on these scoring systems was tied to higher or lower adherence to the Mediterranean diet, specifically within the HS group itself. Ultimately, the adherence to the Mediterranean diet in studies that did evaluate this was associated with a lower severity of HS. Unfortunately, this doesn't tell us much about causality or the way that HS may be influenced by the Mediterranean diet itself. So the role of the Mediterranean diet as an additional or adjunct tool in the management of hidradenitis is promising, but requires significant more investigation. Ideally, future research will focus on a prospective trial with larger cohorts and longitudinal follow-up to establish causality between the Mediterranean diet and severity of HS. This is my contact information. It was a pleasure speaking with you, and here is a copy of my poster. I look forward to answering any questions and meeting you all in person. Thank you.